Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Cassandra, marketing specialist with Achievable, and we offer affordable, adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, MPTE, CSCS, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory-enhancing algorithm, and full-length practice exams. You can try any course for free at achievable.me, and if you like it, use the code podcast to save 10%. Now let's get started. Today we have Charlene Green with us, and Charlene, I'd love if you could introduce yourself.
Hello, everyone. I'm Dr. Charlene Green. I am the Assistant Dean of Admissions, Outreach, and Medical Pathways at UC Davis School of Medicine, located in Sacramento, California.
Amazing. Yeah, thank you so much for being here. So today's episode, we're going to do a deep dive into what medical schools are looking for in applicants and what stands out and maybe what's repetitive. So to start things off, can you just give a brief overview of maybe the top 3 things that you're really prioritizing when it comes to looking at applicants and applications?
Sure. And I think that'll vary by school, depending on what their mission is. So we really focus on kind of social accountability in admissions. We focus on really students who are from communities that have physician shortages, that have high health disparities, because we know that those are the folks most likely to go back to those communities. So that's probably a top thing that we're looking for at UC Davis, is really that mission alignment and understanding communities of need, essentially. Secondly, we are looking for lived experience. Our average age of students, the term traditional student in the medical education realm has referred to someone who comes out of undergraduate directly into medical school. So maybe they're applying in their junior year of undergrad and starting to apply in their junior year. And then during their senior year, they're interviewing, they're doing all their application things. And then basically they graduate in May and start medical school in July or August. So that was termed a traditional student. Whereas a non-traditional student is someone who maybe took time off, they were a career changer, they went and did a completely different career and decided to come to medicine or come back to medicine. And so those are considered more non-traditional students. For us, I think we're really looking for life experience, emotional intelligence, resiliency, the ability to work on things, accept feedback, things that you just learned by living your life, essentially, right? But by being a human being in collaboration with other human beings. So that definitely is a secondary thing we're looking for, aside from the mission alignment and the mission to serve underserved communities. And lastly, aside from mission alignment and the resiliency and adaptability, we're really looking for the future of medicine. So the potential to build physician leaders. So those who have vision and innovation, those who really want to set out to achieve a goal within healthcare. We're really looking to see what does the next generation of healthcare look like as far as leadership. And so that's an important element that we're also looking at, is how will we build the next wave of leadership within healthcare.
Yeah, I think that's really important and really a great overview of not only what you're looking for, but what it takes to get into this field as a whole. So yeah, I think that's really interesting. So let's dive into all the different requirements for applicants. So to start off with that list, can you tell me about maybe recommended extracurriculars or things that people are maybe doing outside of their medical journey that maybe is a bit unique and that might make them stand out? Or are you really looking for things that are related to the medical field?
Great question. Definitely both. So really want to look at you holistically. Yeah, so we're looking at applicants like, who are you as a human being? And really, what are the important elements to you that have helped you get to this point, that have helped you decide medicine? So yes, that could be a clinical experience. That could be doing research. That could be you or a family member had a great experience in medicine. You or your family members had a bad experience in medicine or healthcare. Whatever kind of that prompt to get you to medicine is very important. The other pieces are, there are things that are non-clinical, non-medical, non-academic related that really help you decide or help you build attributes to be a good physician. For instance, right? Being a college athlete, think about what it takes to be a college athlete, right? Determination, discipline, collaboration, working on a team. If you're a classic pianist, a dancer, like again, time management, like all things that are very important in healthcare in a general sense. And again, is it teaching you discipline? Is it teaching you how to work towards something? So think about the things in your life that are just important to you. That's what you should put on your application. Aside from that, of course, you do need clinical, you need research, you need community service. And I always tell applicants that make sure you're not just doing things as a checkbox. It really has to make sense, and you have to be able to talk about those things passionately. So your application might get you to the next step. But oftentimes when I have applicants who do that checkbox thing where, yes, I have research. Yes, I have clinical. Yes, I have community service. Yes, I have all these national awards. They often fall a little short on the interview. They're not able to articulate instances, examples of how they've applied themselves, what attributes came up in them, but they learned some experience. There's no depth. It's a lot of content that's very dry, very surface, but they really don't have the depth. And that's when they flop a little bit on the interview, when they don't have those experiences that are genuinely contributing to their love of medicine.
Yeah, that makes a lot of sense. So that kind of segues into my next question, which is you mentioned clinical experience, research, volunteering. How, like, which does one of those carry more weight than the other, or are they all equally important?
In the holistic review, we're really looking at the applicant themselves and what you did and how what you learned from it, how it contributed to you. So I think I've seen applicants who have 5,000 hours of research and 2,000 hours of clinical work, and those high numbers are not what's going to get the job done. Yes, it is commendable, but really it's like, what population were you working with? What did you learn? As healthcare providers, our job is to take care of everyone. So again, what are you really pulling from that experience that's going to showcase your commitment to a certain population or a certain specialty or a certain community? How is it going to help you achieve your goal? So I think that is more important. So it's really quality over quantity for sure. And I think that that's the other piece is I think people are so set on just trying to get whatever experiences they can. And I know it's really hard for applicants these days. Clinical settings are very already overwhelmed with patient needs, other learners and those things. So it is hard to get opportunities for sure. But the opportunities that you are solidifying really help to build who are you, help you grow professionally, and help you decide what you like and what you don't like. An emergency medicine physician is very different than a radiologist or an anesthesiologist, right? So it's helping you figure out, do I like to be in front of people? Do I like to be behind the scenes? Do I like to do case studies? Do I like to think about problems more? Do I want to solve the problem right away? Do I like working with my hands? Do I like procedures? So that's why that exposure is so important, because it really helps you develop, you will be in healthcare as well.
Yeah, absolutely. That makes a lot of sense. So then next we're getting into kind of the letters of recommendation. And are there certain people that maybe are going to be more impactful as recommenders? And of course, that's probably going to vary by individual. And then also, like, how can students really prepare their recommender to write a strong and detailed and genuine letter for them?
Yeah, that's the rest work backwards on this one. So how preparing to have your letter writer write a thoughtful letter really starts with relationship building. You need to stay connected to people who will write a potential letter for you. So if that's faculty members and that you're connecting with, so like you have a professor that you're really like vibing with, or you have let's say a clinical supervisor or even like a nurse manager that you really still connected with, stay in touch with that person. Like you should be, number one, making it known that you are a pre-medical or a pre-health student. Like people can't help you if they don't know who you are. So you need to make it very clear to folks what your journey is, what's your end goal, right? So number one, it's into other opportunities. But number two, you want them to be able to say at the end of 3 years, 4 years, whatever, I have known this person to be on this journey for 4 years. They've been consistent. They've always been dedicated. They've been working on professional development. You want them to be able to speak to that, right? So again, you want to start doing that relationship early. So that might consist of shooting an email, like during spring break or even the holidays. Happy holidays to start to say, Hope your semester went well. And here's where I'm at on the path to medical school. I just got this really great internship the next summer. I'm so excited. Thanks again for all your encouragement. Maybe we can grab coffee or tea in the spring semester, right? Whatever. You should be reminded of who you are, the relevance of who you are in your goal often, like minimum of 2 to 3 times. I have mentors that I had when I was in community college. I'm much older now, and I still keep up with those mentors. And any important thing in my life, when I got my doctorate, when I got married, when I had a baby, when I keep those people connected to you, for them fit into my identity, right? Because that's what you're doing is number one, somebody to really speak to who you are, character-wise, and your experience, but also that you're the people that actually built a relationship. If they would want you as their adopted from the future. So those are just some tips like relationship building wise. The other piece of this is because medical school is very competitive, you are going to need to apply broadly to medical schools that are typically just one to so most schools, right, are going to want one academic letter, say like I'm a professor. Most schools are going to want a clinical letter, practically my physician, and that's fine. And then a job or community service type of activities, a general kind of like formula. But I always say, yes, do that. And the and part is get letters from people who are going to write you the best letters. So maybe it wasn't a physician, but it was that nursing, or you worked at a women's shelter, and that work is really meaningful to you, and you had a relationship with a manager or CEO there or whatever. I've seen letters actually from the Surgeon General that were not very thoughtful. Yes, you have a letter from the Surgeon General, which is great that you're well connected, but it was very generic, right? So that really didn't hold much weight with us. So again, it's cool. It's really neat why you got a letter from the Surgeon General, but there's depth, there's no depth in what depth, right? So that's the thing you want to think about. Being a cheerleader, who can really speak to the capabilities and the passion that you have in that thing.
Yeah, I think what you said makes a lot of sense. You could get a recommendation letter from anyone that you've crossed paths with, but it's pretty easy to tell when it's genuine and detailed, and you can tell it's like written from the heart versus just copy pasting from the last applicant. So I think that's really great advice. Now we're getting into the academic metrics, right? So talking about GPA, talking about MCAT, and again, coming at it from like the holistic process. Is one weighted more than the other? Is obviously all of it matters, but what's your advice for the academic side of things?
Yes, it definitely all matters for sure. So for that holistic review portion, especially on the metrics part, you get the experiences, attributes, and metrics. So metrics, we're looking at a few things. What we're trying to understand is, can you do medical school? The academic rigor of medical school is unlike undergrad. It's unlike any graduate degree. It's an area a lot of people talk about, like the fire hose. It's a lot of information. You actually will never know everything. And so that's why medicine is a lifelong learning profession. You never stop learning. You never stop reading, and you never stop taking tests. Like that's the job, in case people don't know what the job is. That is like you will be taking tests forever. So when we're looking at metrics, again, assessing can you do it? So if you're early in the journey, the one thing that I really suggest is don't just make it through. I also do part-time counseling academically at the community college I teach. And a lot of times I get a lot of pre-medical students who it's just about getting through the content, right? Like taking the Gen Bio series, taking the General Chem series, taking the OChem series, and moving forward. But you really actually need to retain the content. So get help early, especially I would say on the bio and the chem. If you need help and support, find tutoring, find online aids, find things that will help you really have some level of pseudo mastery in the content, because it's never going to be surfaced again on the MCAT exam, 100% surface in your first year of medical school. So the thing with the prereqs for medical school, which in a general sense is going to be a year of bio with labs, a year of general chemistry with labs, a year of organic chemistry or biochem, and then a year of physics. That's the general package. Sometimes other schools have a few things here and there, but that's going to be the general package. So again, you want to make sure you understand, like for instance, if you don't understand the concept in general chemistry 1, probably OChem is going to be pretty hard. General chemistry 2 is probably going to be pretty hard for you. So it's not just that you're learning to take the exam and pass the class, everything is going to get more difficult, right? And then once you get to those higher levels with like genetics and biochem and things like that, more difficult. So you really do need to have a decent command of the information. And that's going to actually really help you in my book. So start early with access to resources. Schools have resources. People are paid to do these things, and you should definitely take advantage of them. But they are your right as students of that institution. So make sure you are connecting with advisors, to writing centers, all of those things. Just stay connected. So you look at your undergrad GPA. So every school gets like a ton of different numbers. You get your every level of your GPAs from freshman, sophomore, junior, senior year, any postgrad work that you've done, and graduate work that you've done. If you get the cumulative GPA, then we get a separate GPA for all those categories that are focused on your what we call BCPM, which is your biology, physics, chemistry, and math GPA together, right? So how those math and those grades together. Then we get all other category of all of your other things that are not math and science, essentially, the average GPA. So we get these breakdowns, we get an overall number. This is a big grid with lots of numbers, right? So that's really important to know that we will see anything. Also, a lot of folks don't know that for medical school applications, the MCAS is an application. I did that really see. You have to take every posted represented. So if you got a W, you have to put that in the application. If you got an F and then you repeated the trials, then you have to click down to the F and then you grade. And there's a whole pathway. So make sure you're really aware of what does understanding your academic history and how does that affect and what your application looks like. So that's grades wise. And then the MCAT, we do see every attempt of the MCAT. It's an 8-hour test. It's expensive. It's hard to schedule. So my number one grade, like that, the MCAT attendees, that's not what trying to do that. So we will see everything. So make sure before you take the MCAT, you really are feeling that's tailored and ready to take the MCAT before you're going to what happens. So.
Yeah, I think that makes a lot of sense. I'm curious, is there any situation where a high GPA can offset a low MCAT score or even vice versa?
There are always situations, but I think the bigger challenge in the medical school application process is very competitive. And so we this year had about 9,200 applicants and we had 130 spots. And to be honest with you, out of 9,200, like probably 1,500 to 2,000 are great. Like they all have academics, community service, national line, everyone's great, right? You're applying to medical school, you've applied to it. So I think that's the challenge is, yes, a high GPA can offset a lower MCAT, but a lot of schools really think about the MCAT as like a predictor of board exam. That's definitely like the biggest thing out of schools. I think there is becoming like more of a rules on MCAT as just like a standardized test. So thinking about that, but yes, I have seen it where, again, we're looking at the whole matter. So a lot of times people have necessarily a traditional student who just finished undergrad, so they've been kind of taking what I thought, getting good grades, and doing research and doing a clinical experience all in one while they're still like that. So it's understandable sometimes that this person has 4.0, they're at a very like rigorous school that we know to do, they're familiar with it, really challenging, but they were still able to maintain this 4.0. I know they got like negative 500, something like that, and it's not looking for much time, right? You just pick it one time because of the timeline that they're on. So again, we're looking at all of these things, right? Another situation could be like a student who did a prospective student who did a post-doc, a formal post-doc program where, they got a 4.0, and again, they're trying to understand maybe medicine. Having a mid-level MCAT is probably fine, and maybe levels like 5, or something like that is probably fine if you achieve perfect performance in a postdoc, which that's the expected, right? Postdoc is really, I wasn't able to do well in undergrad, or I had a non-science degree in undergrad, or I'm a career changer, and now this is what I can do, and I have support. A formal postdoc is probably focusing on this student is in. So it really helps us understand the type, what and how much they're playing us into be successful, and so again, different situations, and that's what we do holistically, because I don't think there's anything one formula or one thing to select that this package is not there. It's so what was this person? What have they contributed? What will they contribute?
Yeah. Yeah, I think that makes a lot of sense. So then I guess, yeah, like my last, topic would be the personal essays, right? And I feel like this is really where you can stand out and shine. And maybe the most important part of the application, and correct me if I'm wrong, it's all obviously important, but this is really where you stand out as an individual. So can you talk about maybe the do's and don'ts of the personal essay?
Right. As I mentioned, the medical school application process is very competitive. So when you're competing against, right, 9,000 other people at a school, it is important that you really have a compelling difference, right? Because you might have similar packages as far as grade, research, clinical work, popularies, grade. But now we're like, why medicine? Who are you? Why do you want to do medicine? So that's the first mistake I see people make. They spend a lot of days on that person's statement, and by the end, I don't understand why medicine. They want a story, but I don't understand why you want to do medicine. Another common mistake I see people make is I think applicants feel like they have to sell a tragedy to be compelling. Instead of always telling people, be true to who you are. If you did have hard things happening in your life, it's okay to write about them to help maybe the reader understand, like, your perspective and where you're coming from. That's great. Don't spend all your real estate there. And that's what I'm always telling people. I've just seen them say, my cat died, my grandmother died, my neighbor died, everyone died. And now I'm crying and very sad, feel bad. But I don't know why you want to do medicine, right? All of these horrible things happen, but it didn't tell me why you want to. The other thing I see people do is actually having like significant hardships and trauma in their life is we do blind interviews at data, but many schools, right? I just made it the same person statement. Many schools do an interview where your application is their game. So anything you write in your application, it's prepared to talk about. So I've sat on other interview panels, so other schools and other like pathway programs where applicants wrote about some really tough stuff, really tough, very compelling. However, they weren't able to discuss it in the interview. They actually broke down, an emotional breakdown was fine, and understandable, very hard situation. But again, you're not able to get through your interview if you're very emotional. Think about what you're writing in your social statement. Are you going to be able to talk about this in a way that sets you up to say, yeah, I experienced these hardships and these tragedies, but it actually just helped me more towards this. And now this is what I've done, given my steps I've been to foster that and grow that action. So are you going to be able to talk about it and not giving up like that? That's an incident. If others have heard me talk on about webinars and YouTube sessions, I always talk about my personal pet peeves, and this is definitely not all about this case. But I really don't like when y'all start pushing things like sound like the ambulance should be on the street is like diving. It's very dramatic. So that's just a me thing. But I could by the time a person with particular type used to be, there's 30 people have interacted with their applications, they still not at me. Here's a pet. You don't mind. I just think it's dramatic. I'm like, I want to get to the meat of why you want to be able to. So when we tell people, the first thing is just get words on the board. Right? So like personal statement starter paragraph on it. First, why do you want to go into this? Right? Since you're poor, you got science, and then you have good experience, you have bad experience, and much data, etc. That's kind of like the first get words on the paper time. Step one, step two is the middle part. It's not the most important. What have you done within your step as a medical student to foster and build that? That's nice. What have you learned? What patient have you been at that being inspired? Things like that. And then lastly, when a smaller chunk is, what are you going to be in medicine? Like, didn't think you're going to do you want to do research? Do you want to do academic medicine and teach somebody? Are you going to do passive programs and help actually the next generation of medical students and getting them to take into in medicine or healthcare? But now what else do you want to do besides see patients every 15 minutes, right? So that's just a place to just get words on the paper, and you got to edit it. Your personal statement, if you don't have at least 7 versions of your personal statement, you're probably not doing it right. Applying to medical school is not a let me sit down and do this weekend. Or you know what, I'm going to block off 2 weeks every day. It's probably a 10-month process of really going through each element and making sure you have the best application to work for. That is like the key thing. It's expensive, it's draining, and it's not something if you can avoid it and you're going to be more quick.
Yeah. And I feel like that almost seems so obvious. Like, why are you interested in medicine? But the fact that so often people forget to include that, I think that's great to bring up because that is the whole point of why you're doing
Don't
this.
into the nap. Like,
Right.
I want to be a physician because my dad was a physician and my grandfather was a physician. Then, you know, what did you see them do? What inspired you? Do you remember certain patients that you're okay? Did you go and work with them and see how great they were with patients? Did you see them not being great with patients and you want to be better than them? Like, what else besides that?
Yeah, absolutely. I think being able to get into the depth of your story is really important. And like you said, it also really shows maybe what shows confidence, but it also shows like authenticity. Tell me more about this experience that you had, even though you just wrote about it. So then I guess like the last thing is the interview. So how often are you looking for new information that maybe isn't in the personal essay?
I would remember that question because I want to go back to one thing on the presentation that I did not talk about, the super
Yeah.
hot topic right now, and that's the use of AI. Still,
Of course.
yes. So again, I don't. Many schools don't have a policy on can't use AI on an application. I actually don't mind if applicants use AI, but it's like, how do you use it? So number one, you need competence in writing. If you're going to be a doctor, like you got to like be able to explain things to patients and educate people. So you need to like have command of the language around medicine and medical. So you're doing yourself a disservice if you really are solely using AI. And I'll tell you why I'm bringing this up. Just in a second. So I don't mind like if the fact that after like they use AI to get things started, to build structure, to outline, to organize, to revise it and make it their own. But I can tell you, as someone who reads thousands of applications every year, I can really tell when you just copy and paste into AI, and it is one. So again, no policy that you are not going to have a compelling story if someone else wrote it for you. If a computer wrote it for you, it's not going to be as compelling as if you write it yourself. I'd rather have it not be perfect, so definitely check for grammatical things and things like that. But I'd rather have it be more simple and simplistic and tell your story than you use AI to have all of this like elaborate language and examples, and someone even cited some research in their personal statement. Keyword personal, just so you know.
Right.
So really be cognizant of how important authenticity and genuineness is, because I feel like I'm reading the same person statement over and over again, because everybody's just confusing AI, and that's unfortunately what kind of gets you pushed to the side, not because you used AI, but because it's bland, it's the same as everyone else. So that authenticity is very important. So I'm just providing a word of caution on how you think about updating your personal statement when you're thinking about you guys need that. I'm off my soapbox. Okay, I want to read more statements in your next cycle. And so interview. Okay.
So I'm curious how often you're looking for new information in an interview that you haven't already read in the personal essay.
Great question. So again, you see theory-based school of medicine, you do blinded interviews. So you will actually interview 10 people because you do multiple minute interviews. That's like speed dating and reality TV. And each of our stations are focused on actually one of the WNC professional competencies, so like teamwork, resiliency, adaptability, ethics, things like that. Each station has one of those topics. So again, you get caveats, ethics, adaptability topics. So in the interview, we really aren't comparing the application. However, post-interview, when your application is routed to the next committee, they're really looking at your entire application, including your interview notes. So number one, they're looking to see where is their flow and where is your application as a whole telling a story, including your interview. So if you're saying in the interview, because we are a primary care school at UC Davis, so about 50% of our students stand at primary care, but this is important. The other 50% stand to other specialties. But if you were saying in your interview, I can't wait to do primary care, like I want to help underserved populations, and when your application is, I work at I do scribing at a plastic surgeon's office in Beverly Hills. Okay, that doesn't make sense. That math does not add up. So that's the thing we're looking for, is like your interview making a sense of the rest of your package. You say you're genuineness, authenticity. Those are important things. So your application of a full including interview really needs to tell a standard and needs to be consistent. So that's an important piece. Now, some schools, again, who do technical interviews are looking for something new. They want to ask a question where you get enough information to you and have signature and application. So again, everything is fair game. So make sure you really know what you wrote, and then that's the other downfall of using AI is a lot of people really can't teach you what to work and they're not sure about it. So really understand what you wrote and make sure you have an antidote stories to go with your experience that you're ready to use, and you can help provide a structured answer in your interview. So that's the other thing we're looking for when we say you need information, maybe not just content, but communication skills. Would I want this person to be my doctor one day? Are they searching to do? I don't think you have to be doubling or being stoic is like not great, but you do need to be personal. So you can be a person to a pitch. The person's not gonna
Right.
want to open up to you and talk to you about things if not flat out there to do start. So again, so that's the new information that comes up is like, what are your other attributes that are like visible or verbal, like audio? So those are things that are really important to you.
Yeah, that's great advice. And then, yeah, I guess, is there anything that we missed that you want to make sure we touch on?
The only thing I will say, I know I should say, this is my number one. I say it, everything I say, but this is one of my number one guides is I always tell applicants, apply to medical school when you're ready to apply. And what that means is you have your best application to pay for it. This is a hard process. It's you really want to make sure you're ready and focused on what this is. Number two, stay organized. Like you should be calendaring, like you want to say the secondaries are doing, the interviews are, getting familiar with the interview platforms, if they're virtual, like you're really doing your homework on doing organized. I think the last thing I'll say is you have to just process that. Like you need to be working with your health professions advising or faculty in the science department to live on this very good news. And you should be working with people who have helped other people get into medical school because they know what good applications look like and they know what applications that needed to do looks like and listen to them. They have experience. So make sure you're finding the right group to kind of surround yourself because I don't know about yeah, but my mom loves me. I said she everything I do, she's like, it's wonderful, it's great. So having your mom be a good person feeling like that's fine, but you probably want to do someone who probably have a little bit more depth and depth.
Yeah, absolutely. That's really helpful. Thank you so much. This has been Board Certified, hosted by Cassandra from Achievable with Dr. Charlene Green. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, MPTE, CSCS, and others. And you can try them out for free at achievable.me.